is Dr. Steve.
Hi, I'm Dr. Steve Salvatore. Thanks so much for joining me today. We're going to feel a whole lot better and be a lot smarter after today's show. Up front, if you can dream it, our plastic surgeon, Dr. Elie Levine, can create it for you. Please welcome Dr. Levine and his wife, Dr. Jody Levine. They actually practice together on Manhattan's Upper East Side. And you're also married with 4 children, we should say, which, of course, comes with its challenges.
It does.
Actually, you guys do pretty good. So she's a dermatologist, you're the plastic surgeon.
Yes.
Okay, so today we're talking about something called Vectra 3D. What is that? Explain that to people.
So Vectra is a 3-dimensional analysis system that can be utilized for assessing contour regularities and shape and asymmetries both on the breast, body contouring, and the face as well. And it's revolutionized consultations for patients because until now you could really look at 2-dimensional images and look at pictures of similarly shaped patients, but at the end of the day they really couldn't see what a procedure could do for them in 3 dimensions.
So basically, Jody, what it means is that someone can say, I want this procedure done, and they could see in 3D what they're going to look like?
Exactly. It's amazing. It's great not only to visualize the surgeries that Elie can do and the results he can get, but also sometimes people don't realize their own asymmetries. You're so used to looking at yourself.
Right.
And when you see it in 3D, you realize what can be done.
Yeah, I don't know if I want to see myself in 3D. but you mentioned breast, so let's talk with that because that's something that's big for women. I mean, augmentation and reduction. So how would that work for someone?
So many people in this country, if you look at the numbers of plastic surgery procedures, breast procedures are typically near the top of that list. And when someone comes in, they have a vague sense of what they want to accomplish from the procedure, but it's hard for them to transmit that information. And so we can look at similarly sized and shaped patients and similar patients that may have gone through a similar procedure and try to assess how that they can extrapolate that for themselves. But at the end of the day, until they can look at themselves and see what they're going to look like, lifted, reduced, augmented, and then say, yes, this is what I'm looking for, that's really what will give them the sense of comfort before they proceed with something.
All right. Do you find it really challenging, though, when someone looks at that you have to exactly meet those expectations? Is it easy to do that?
No, I think it's so helpful to me because it gives me a window into what they're really looking for. And we do sizing, particularly for breast augmentation, and we talk for a long time. But at the end of the day, until I get a sense that they're looking at this software and they really see what it can do for them, that's when I really know that we're going to accomplish a lot with this procedure.
Right. Okay. So that's breast. Another big one, though, is rhinoplasty, right? Nose jobs. People want that.
Yes.
Jody. So how does that help people with that?
I mean, sometimes people come in, they want a nose job, and they have a bump on their nose or a big tip, and really they need that, but they also need a chin augmentation. And Elie can show them on the Vectra what they would look like with the chin, with the bump shaved, you know, the various different nuances that he can do.
There's such a unique relationship between the chin and the nose, and oftentimes I will put up a picture of a patient who has a very small chin and may need something to their nose as well, and I'll adjust their chin and I'll show them a before and after that, and they'll say, wow, it looks better already, and I'll explain that I haven't even touched their nose yet. It's simply their chin, and you just see this like sense of recognition go off in their eyes.
Face and neck, because women are always, well, women and men, you know, one day talking about their neck. So how will that help me?
Well, with the face and neck module, we can show a patient what they will look like with a facelift, with a neck lift. It also helps you see facial asymmetries, contour asymmetries, as well as skin texture and pigment.
Which are huge.
With extreme clarity. Yes.
Right, and that, again, is very helpful for you.
It's helpful in so many ways. It's helpful to give me a sense of what we're going to do in the operating room, but it also gives me a sense of what the patient's expectations are. Because sometimes patients will say, can I do this with it? And I'll explain, no, we can't do that surgically, but we can do this. So it lets us come together with a game plan that's going to make everyone happy.
I think that's really, at the end of the day, what this is all about. It's about patients' expectations and meeting that. Now, one area that people, of course, always, you know, would love to see the pictures of is liposuction. I would think that this is a great device for liposuction. It's great for
liposuction because with liposuction's ability to both remove fat and skin tighten, it really gives patients a sense of where they can go with a procedure. It also gives them a sense of comparison. So if someone comes in and they have a lot of abdominal laxity, are they best off with a tummy tuck? Are they best off with liposuction? I can show them in a 3-dimensional way what's going to be better, what they're going to be able to get with each procedure, and then they can proceed with what they think is right for them.
Well, I got to tell you, I've seen your work, and it's amazing. What whatever you guys are doing, keep doing it because it really works. It's fantastic. Thanks so much for coming in. I really appreciate it.
Thank you so much.
If you're